So today the topic is elective oocyte cryopreservation for age-related fertility decline and facilitating informed decision. And icon for the today's speech is Dr. Mustafa ZAKARIA, and this program is sponsored by Dr. Ritu Santwani. So before we start session, let me give a little introduction of our madam Dr. Ritu Santwani. Ma'am has done MBBS, MD, and MRC member of MRCOG. Ma'am is working as a consultant in Shambhal Women Clinic in Koregaon Park, and also ma'am has recently have a new fitness new studio in Koregaon. So, ma'am, congratulations for your new.
Thank you.
Also.
That is 360-degree healthcare
360
studio.
degree. Yes, ma'am.
Yeah.
So, let me also give a brief introduction of our icon for the day, Dr. Mustafa ZAKARIA. Sir is MD from Morocco, and sir is the chairman of Executive Committee of Moroccan Society for Endometriosis and Reproductive Medicine. And sir is senior clinical embryologist and assisted reproduction. Sir has extensive experience and covers all aspects of clinical embryology and endology. Dr. ZAKARIA obtained his master degree in clinical embryology and assisted conception from Northwestern University, USA, ART as a consultant reproductive biologist in IVF laboratory, fertility center, IRIF-IV from Casablanca, Morocco, and Group Vice President of Scientific Research in 2018. And sir has obtained a research fellowship certificate from IRIF-IV-AI SRG 2020. Sir is sir also got his certificate in clinical reproductive science in November 2019. And sir has acquired a distinct interest for oocyte and somatic cell communication, embryo morphology, and optimizing quality in the clinical IVF lab. And sir is member of vast societies like ASHRAE, AC, SRB, ARCS, then Moroccan Society of Reproductive Medicine since 2018, and of Royal Society Medicine, RSM 2020. And you can also visit Dr. Mustafa ZAKARIA's website, that is www.dr-mustafazakaria.org. So I welcome Dr. Ritu Santwani and Dr. Mustafa ZAKARIA on our platform for today's session. Thank you, ma'am.
Yeah. Thank you, Doctor. Yeah. Thank you, Dr. Nishan. Thank you so much. And thank you, Shield Connect, for providing us the platform. Dear friends, all of you are welcome for this academic exchange program. I always believe that knowledge always increases by the sharing, and knowledge is not limited to any boundaries. With this motto, I have started this series. Happy to invite my dear friend, Dr. Mustafa ZAKARIA here. With Dr. ZAKARIA, I have done earlier also 3-4 programs in his society also. All are very well appreciated. And today he is going to discuss with us a very, very important topic regarding this elective oocyte cryopreservation for age-related fertility decline. Because in these days, so many girls are approaching in our OPD also, having a query. They have read somewhere the half information for the oocyte preservation. All are oriented to career. So now what are the new things in this? So Dr. Mustafa ZAKARIA is going to discuss with us now. Before that, tomorrow we are having one great symposium under the leadership of Dr. Mustafa ZAKARIA on the ovarian endometrioma. So all of you are welcome for that also. So now over to Dr. Mustafa. After his lecture, we can take some question answers. A warm welcome. Salam alaikum to all of my dear friends who have joined all across the geography. Yeah, over to you, Dr. Mustafa. Yeah.
Thank you so much, Dr. Thank you. Averted of oocyte cryopreservation in age-cell fertility, the science of connection of ovarian decision. Webinar Missile 2022. Science and practical interest now. Fertility preservation increment. Planned Oocyte Cryopreservation POC. The impact of age on flight rates. PCO. Links to oocyte cryopreservation. Session 2. Cancer. President. Patient. So, will be detective on the side to woman of the limited rather than the client on our side purely to control and defined and protecting and the woman and ever become the mother the within she ready is looking in crystal world. Some women may be come from an abnormal in that under the follicular port, so just and reversing in surgery and mode and rate on follicle decline and deep impact in hasting and difficult hasting to correct. Not only doing to see decline of number of eggs, but also in the quality. This slide shows data from PGDA in private and clinical Italy for blastocyst android in cohort pricing in blastocyst from patient among of maternal age. Increasing rising was also chromosome, which is inclination, and driver pricing, wanting fertility and decreasing age, and consequence in the pulse of number of oocytes to need in women and the phrasing in the cross and blastocyst. This is in situation until but and correlates with the natural rate of fertility and preservation. What are the main of the education of the oocyte cryopreservation and ART clinical? This is a picture in the global C4 in the fall part in Norway. I would like to use of us and metaphor information in affecting freezing and education. Typically, women who have to directly frozen into absent into for fracture and hoping that doing have POI the same full photo in the place in the seas of retrocent of race of an ovarian stimulation. We hope we will have to never have to see the story of oocyte cryopreservation, amount on indication in cryopreservation, and identify and both intubation in outer site in cryopreservation formally insulin freezing, non-elective in cryopreservation includes infertility, in medical freezing, in clothing intuition. Let's start with the planned oocyte cryopreservation. Why do women and the prison in to place and see in a hormone college this is relevant in 150 women in Israel in Dirolest? We have to complete it in price and inside its life on freezing. According to pricing of result, all side where validation is not being used because of current blind, but rather for fertility in cryopreservation. It is infertility. Women in adulteries in our deferred. Women we did not and the thought of grant self to birth fast. You are facing in the earth on the reproductive side. Even in most cases, it provides women an request because they would dance. We have to withhold POC and doing stuff to the heart. Talking about buying oocytes in cryopreservation really is often the violent of mine. Probably not because the exit Android spreading and the cause of biologists in to check improvement of metastasis and health to follow up the signature to the CRs. However, this is as a major to bleeding process. This decisions intimately should not be done into oocyte freezing, peace of minds, and dimension on quickly of life, the blind of oocyte freezing. This psychological and to profit into cryopreservation is clinical increase in the price of the result of number. This is study which is in surveillance. It's half the Phyllis image of Android did its own provides of the biologists of the blind to oocytes in cryopreservation. So the meteorologists at the women POC and to oocyte cryopreservation to publish with internet in plus studies. Which you recommend and other people would have to face POC and preserve in 98% of women ingest and the question in the concept of the guard force into gain 80% for even more city but one of the data and people and nevertheless decision of the regulate this important in the conception with the parts. This is why of an adequate of counseling of the correcting and speech. And it's very important. We should have to have a proof in all size banking in women of the saints. After the latest in 38 in 48 9 on in women with low variant slow itching democracy, we have to explain to the spectrum in the fasting into multiple and transport to all size stimulation of the thing into reasonable of all size in women to also credit that it happy not to have done at age 88 younger age. So for plan or oocyte cryopreservation POC, Isaac growth counseling of the pollution into important. Be called in into the recommendation for the arch into also and law. in 2012. In so of the Christian, we should not rest false of prayers. We should not in presenting of this absent the word as successful at the situative it is not adjacent. Should be under work on the instruction of mission, which of the presentation of successful reproductive in overview of our agents. And we should evaluate in every candidate in each of our results and tomorrow. Long time of remittance should have to outperform in holiday prices in 2 months to be able in the correct and the ovarian into this parameter to oocyte. We should discuss of current performance and the delimitation of the captain would the process be in typhoid of missing to ultimately use up in the future has we should dose the castest with this with this all size and can use the previous of storage the use in the theta in the other ice or sites. Also was also winners in the college of the cancer induced to pulse and to liver all sides. Is all sides in safe to ovarian stimulation does not increase at the one of the Barcelona of Spain. So unemployed embryo is not difficult to after insemination compared to birth. So this is important. This is very important parents for our patient. So undergo with an insemination to undefreeze. We should explain for information and the long on time the safety of oocyte verification cannot be verified. So the number of children born after the use of voting is limited and stimulated lifted and followed on limited privacy. Nevertheless, for epigenetic and safety data, we are to show that this study was our central with pride, showing data of global estimation with in seminars of vitrification and oocyte in so in vitrified for the innate price of genetic. Also is alternated and fresh oocytes delimited, incomparable to pregnancy and also to we also fresh oocytes. The more oocytes, the better. Has been into control in controversial assessment of instandering we on treatment of a group and price 3 out and after we 3 single out cycle with a single as part in ovarian to prescribe. The figure points on this slide is not direction which offers single slide which only from the single always and single slide to woman's body and the quarter of the parts in the data was in the world. Into each spy in Spain, which in young women we see that strange cumulative into of number of single and the services which increases in transfer. But this is not the cases in women advancing. Is this data I align with studies collected of embryo. The protocol of had a euploidy divided bonds and one cycle is also in high dependent and to force and more to acts and more the age. This not the results of first in proportion I deployed embryo. So In high-risk responder, we should not longer be after severe ovarian hyperstimulation is simply preventing complication as low as stimulation with the autograph engineer are particular, and if you use words is agonist and frega for final of oocytes integration or obviously parts in cryopreservation. So, however, ovarian stimulation in predicted and how proper standard should be introduced protocol. This patient of 40-44 is old and want to plant in the profound card. It with what insect AMH and a normal BMI ensures arch stimulation in 150 unit of recommendation of daily, which in result of in excessive borders at 125 in Spaniel and being prescribed in cryopreservation. The patient suffer in significant attitudes usual in LN lines for LH line volume on ovaries and usual subportion at the price. In this title of patient, severe ovarian and volume stimulation in stadium authorized in incident to overmine and, and to numerous price. It could be in size in 38% would occur in silver for onsen and the ALS for this patient. What do you know for returns of after POC in plan in oocyte cryopreservation? Several in chapter had been published of looked at of reproductive studying in attention in women in how to apply into oocyte cryopreservation. And we recording in the odds we all described in comparison. We also in this course of important increasing approaches on the freezing of plant in oocyte cryopreservation. But as IUI to interpretation is not don't recast really we don't spec. What do you actually of reproductive outcome of women with data plant of those in cryopreservation? This of data of blind oocyte cryopreservation. This of a group of another of analytes. Nearly 50% have tried to concede after playing on oocyte cryopreservation. And of those who you can see in those women carcite or 70% had shift on a pregnancy. Of those we conceive if only 7% have to live birth and 50% have to study of have to be on conception and have to be in inception and inscriptions of the dance had national in conception. With those far on to add the freezing, it will be that plan and freezing enhances interpretation in women to have to stable to in relationship education with earth, which is into pregnancy. So imagine indication for non-elective infertility in preservation in women who have to indirect waters and who have to starting for that may be toxin for the follicles on the right side. For ovarian stimulation, we need more or less 2 to 3 weeks. This is not impossible ovarian tissue in the cryopreservation collection of immunization for micromotivation. So random restart for protocols for environment stimulation in past and predicted wildcard start invariant with stimulation in kind stage for impulse of cycle. In lateral result candidate are artists women in the cause of cancer, which is in subcortex at the risk of disease. Generator of tagonist in canopies for introductions. This is of LH to introduce of number to this in the cast. Results with also similar in the outcomes with this generator of tagonist and ignition of the price, which should be not reason applied to Onco-Fertility Preservation. In the course of reason and successful to weave off an IVF the process of cancer, and we respect didn't toast women and we have to who plant oocyte cryopreservation. What are clinical outcomes when used in vitrified oocyte for fertility in preservation and across a different indication? We see the coding of disease as spiteful, mostly light above to 80%, live birth life range of light 20%, 2.5% depending on indication. There will also be handsome of in alt freezing individuals in the first single. These in winter intervals have a very low fertility because the bottom of and the variant failure. And on the adolescents, we showing we interested in freezing. What have to send single, it will be useful for individuals and the conflict in camulants and hormone and two offers to offer freezing intimation of a star. The decline, obviously the class of the persistent offering in cycles of the monsoon impose the delays of rickets and tolerate into the smell of stimulation and to believe of. And also higher words have force in chromosome in normality in absence of implicate assumptions and of a messenger. And therefore of PGTA has been recommended in the miscarriage as was ISIS and born into normal population. So what would you need to force for this and approach and not? First of all, and guys, ensure let's see. It is necessary for not whole to increase the charging of having the biological transport. In a view test, counseling is everywhere clear in details with the price of motion or to urge of fertility in preservation. Fertility was around was of first line to make of ovarian. It was on FSCH and MAH. It was of ovarian stimulation protocol for 80% to participants. Take the from research. The number of of size may be kind correlated into totality of rice, especially of the brains in young women, and predicted in health of required specific attention, whose ponder indeed make niche in multiple tries of fake freezing, and highest order standard, which of crime increase into artifacts, into complication in the source affirmment. So thank you for this attention, my presentation.
Yes. So I have received some questions. Can we take that questions with your permission?
Yeah.
Yeah. So this is the first question is from Dr. Maria. Dr. Maria has joined all the way from the Spain. Her question is, can fertility preservation interfere with successful cancer therapy or increases the risk of recurring cancer?
Okay.
Yeah.
This question, they are not a victim of that is correct. Okay. So the infertility preservation must correct indirectly to connect with unsuccessful of the cancer. Cancer which treatment was however correct to successful of treatment if you wisdom or surgery in chromosome with a pipe on fertility and preservation.
Very true. Very true. Thank you. Thank you, doctor. The other question is from Dr. Ionis from UK. His question, what can parents do to preserve the fertility of a child who has cancer? A very practical question.
Yeah, this for child.
Yeah.
Fertility should be discussed. Was with children. The children thriving of cancer as soon as what old is enough to understand. But you connect with of children to make a request before in predictions to be in connected them to have we has we cancer of children.
Yeah. Thank you. Thank you. Yeah. Friends, those who have joined late, I am getting so many inbox messages. The program has gone live already on my YouTube channel. The link I've already pasted in the chat box. You can see from there. So now I'm taking the questions. We have received some questions via YouTube also. So the other question is from Professor Carlos Simon from the Spain. He has joined. How will the eggs be used in the future?
It's good question because when the woman of ready to use for freezing age at hardship or pregnancy, this was in cryopreservation age of the plain water insulation to ask for ART to have resolve on oocyte freezing with selective of increase for Higgs.
Yeah.
This
Thank
is
you.
a short answer is good for this question.
Yeah. No. This is a crystal clear, short and crisp answers. Yeah. So other question we are having from the Dr. Kiris. He has joined from the UK. What are the chances of a successful pregnancy using frozen thawed oocytes?
Really, this question is good for clinical pregnancy related. we have been to stimulation between 4 to 12% to power of an oocyte, increasing to how we know with more data will be to need have to letter of an ID there a successful rate of in oocyte cryopreservation.
Yeah. Thank you. Another question related to this only from the Professor Karasti, has joined all the way from Sweden. It's actually same question almost. What are the risks associated with the oocyte cryopreservation procedure?
Procedure.
Yeah.
Okay. This full age of fertility rates, the rates with consumption for ART and Proctron. So, to ovarian gestation of IVF, in which indicator some traits in hypostimulation and syndrome, which is controlled with the different for age related of growth form. So, the age freezing rate of ovarian to hypostimulation and syndrome because when the eyes offers the fertility entrenchment of its to life for infertility.
Yeah, thank you.
Okay, thank you.
Yeah. Another question is from Dr. Michael from the Austria. His question that how long can the eggs can be stored?
How